Hi there, and welcome to DTV. I'm Gloria Johnson, and I'll be your host tonight. We're going to talk about a really timely topic. We're going to talk about healthcare tonight. And so we've got a special guest with us, April White, who's a mother who is currently on ACA, as are her children. But one of the things that we're hearing the big concern right now is that a handful of senators are writing this legislation behind closed doors with little input, quite frankly, from their own party, but certainly no input from across the aisle, no expert input, and certainly no input from the folks at home. And it's a very unpopular idea. Right now we see that this is probably the most unpopular legislation in modern history. Right now I think it's at about a 17% approval rating, but yet our senators are saying they're going to vote by the end of this month on this legislation. A couple of people that have made visits to offices or have called offices, we've heard varying answers from our senators because they haven't come back to Tennessee. They haven't done a forum anywhere around us in Tennessee that we can talk to them about this legislation. They don't hold office hours when they're on recess. Back in Tennessee, I know that April has visited their offices multiple times, as have I, tried to set up appointments, and we get to talk to staff. And on Tuesday, we were told by staff that there was nothing in writing yet. One staff person at the Knoxville office told us that the Senate was throwing out the entire old bill and there was nothing in writing yet, which is not what we're hearing from DC and the people there, because there was a senator that came out the other day and said that this bill is going to be 80% like the AHCA, the previous bill. The bill that the House passed, and after the House passed it, President Trump threw a beer party to celebrate this, and that was a few weeks ago, but just this week he said that the legislation was mean. So, which is it? We're getting a lot of conflicting information, just a handful of senators working on this bill, and even a caller who called the Washington, D.C. Alexander office yesterday was told by Alexander staff that, because this person asked for public hearings, and they said, well, you need to call Mitch McConnell about that. Senator Alexander is the head of the Health Committee. He should be able to ask for those meetings. And right now we've got Corker and Alexander from Tennessee both saying, oh, it should be an open process and we should have public hearings. But neither one of them are standing up on the floor and calling for that. So it's one thing to go back home and say, oh, we should make this public, we just can't do it. They can do it. They can stand up, demand, call a press conference, demand that we have public hearings on this, because we know that there were 270 hours of public hearings with the ACA. And so I think that the people of Tennessee deserve to know what this bill is in advance, see it in advance, and be able to talk to their senators about how they feel about it. So as a mom who has ACA, how are you feeling at this point, April?
Well, I'm scared. I'm worried about what will happen to my coverage if the new bill takes effect. I'm also worried what will happen to my premiums next year because of this limbo that they're leaving the current law in is causing premiums to go up, because now is the time that insurance companies are setting the premiums. So I worry what's going to happen there. But yeah, so I worry. I read a lot of stories. I call, I visit. I've visited all three of our members' offices with my twins to talk about how this bill will affect our lives negatively and impact our health.
Well, and tell folks a little bit about your twins and the medical issues that they have, and certainly pre-existing conditions, because they were there in the womb. So
right. I have fraternal boy-girl twins. They are now 4 years old and healthy and doing well, but unfortunately they were born at 30 weeks instead of 40 weeks. So they came 10 weeks early, and they spent over a month in Children's Hospital.
Wow.
You know, their hearts would stop beating. They wouldn't be able to breathe. They were on oxygen. They came home on heart monitors because even after they reached their term birth time, their hearts would just forget to beat. And so we had heart monitors that would alarm and wake us so that we could wake them. So they had a lot of expensive medical equipment, medical care. Both of them spent over a year in therapy at the Children's Therapy Center. At one point we were going 4 days a week for occupational therapy, for sensory issues from being in the intensive care unit with all the loud noises and things instead of...
Oh, I never thought about that.
Yeah, it affects a lot of preemies. And speech delays, motor delays, they were both late, and all of that stuff because they just didn't get to grow where they're supposed to grow the whole time. My son was also born with a cleft lip, and so he's 4 years old. In his first year of life, he had 3 surgeries, and last year we had a 4th to correct that. He still has speech therapy 3 days a week to work on his delays from that, but otherwise he is now caught up with his peers.
And now that when I see them, I don't think about any of those things. They're regular 4-year-olds, you know, which is great.
Yes.
But that's what got them there.
Yes, it is. Yes, and because the ACA was, they were born in 2013, and so because the ACA was in effect at the time they were born, I was covered under my employer plan, and so thanks to the end of lifetime limits, my family didn't have to worry about bankruptcy to give our kids the care that they needed to get better. Just their room and board at Children's Hospital was almost $500,000.
Oh, wow. And you think about that, and that's one of the things that's in this bill, taking away the protections where there's no lifetime caps. We'll be going back to lifetime caps. Even the talk in the Senate now, they're going to take away the protections that we had about lifetime caps. And what a lot of people don't understand, that's also on employer plans.
Yes.
It's not just ACA plans. Everyone is going to go back to having those lifetime caps. So I've got a friend right now who's pregnant with triplets, and typically triplets, they come early, and it's not unusual for them to have a month in the NICU each. You know, those are kids that are going to be really close to their lifetime caps just in their first month of life. And so we can't do that to people. I mean, it's just outrageous. The study from Georgetown just came out yesterday that said that this bill currently will cut 50% of America's kids out of care, out of having health care. And we just, how can we do that as a nation? I can't understand it. The Medicaid cuts alone will.
Hello, buddy.
This is
no, here it goes.
one of the 4-year-olds.
Yes. Hi.
Mom, why singing here?
Honey, see, we're on TV right now, okay? Can you go back and play with your sister?
Why you almost done?
It's not, it is, it's just now started. Can you go back and play with your sister, please? Thank you.
That's awesome.
Yeah.
Did he? I don't even know if he saw him, if he got on there.
No, yeah. So, thanks to the care they received, though, from the wonderful people at Children's Hospital, he's a normally developing child now, and he's caught up with his peers. But we were lucky because of when they were born. But right now, there's somebody who may not be as lucky because their kids are going to be born under this new law that passes. And they'll be faced with giving their children the care they need to give them the best start in life, or bankruptcy.
Well, sure. And what we know about the AHCA, the bill that the House passed, what we know is that pre-existing conditions were no longer protected. You know, they can be waived by the state. What we're hearing about the Senate law, which again, it's not written down. We haven't seen it, but rumors are
Right.
that they're going to keep the covering pre-existing conditions. But the problem is, what they're saying is they're going to take away or waive the 10 essential health benefits. Well, those 10 essential health benefits are the things that cover those
Right.
pre-existing conditions. It's medication, it's testing, it's hospitalization, it's maternity care, it's prenatal care, and childbirth. So we know in Tennessee, 40 to 50% of women who give birth use Medicaid funding for
Yes.
that. And we're going to cut $800 billion of Medicaid funding. You know, we already have a child mortality problem in the state of Tennessee,
Yes.
one of the highest. We're just going to make that worse. I mean, everything we are doing or considering doing is going backwards.
Yes.
And, you know, I talk to so many families who are scared to death of what's going to happen. You know, I've got friends who are cancer survivors, but I've also got friends in the middle of their cancer treatment. And they don't know what's going to happen. And because of all of this upset and the repeal and nobody knows what to replace, as you were talking about, they have sabotaged
Yes.
our health care in order to make it look like things are bad. And people in Tennessee really struggle because we didn't expand Medicaid. So they see people in the gap, the people that should have been covered by expansion of Medicaid without insurance. And that's your working families, you know, that their insurance isn't provided through their work and that sort of thing, who are going without now, which has caused us not to get the funding, that $1.4 billion
Right.
that Tennessee turns down every year, which has caused our hospitals to close. We've lost 8 hospitals. We've got other hospitals on the books. I'm hearing that it's possible, Blount County, that these cuts to Medicaid will make it almost impossible for Blount County Hospital to continue. And so we're threatening our hospitals. The study just came out a couple of days ago about employment. I think it's something like 3 million jobs will be lost
Yeah. The rural
nationally.
Right. The rural hospitals are a big job provider in these small
Right.
communities. So when they close, not only are people losing access to quality care within close distance to where they live, but so many good paying, steady jobs are leaving the community
Right.
because Tennessee refuses to accept that money.
You take a county like Scott County that has a hospital and that hospital closes. You know, that's several hundred jobs in a county with one of the highest unemployment
Right.
rates. They're not going to find another good paying job in Scott County.
No.
And so I know at Blount Memorial, I think it's something around 2,000 jobs. You know, where are these 2,000 people going to go in Blount County to get another job if that hospital were to close? I don't know that, you know, it's super at risk, but I just know that Tennessee Justice Center has a list, and they see that as one of the hospitals
Right.
that's endangered. And so, you know, these cuts to Medicaid will kind of be the tipping point for so many rural hospitals. And, you know, I saw a presentation from a CEO of some rural hospitals, about 6 rural hospitals, I think. It was a live stream from Jackson, Tennessee. And here's this adult CEO hospital, you know, these rural hospitals. And he's talking about, because of ACA, the people who are now getting the care that they need. And he's talking about, you know, how people are not using the emergency room so much
Right.
that they're able to go to the doctor. And, you know, it takes a while for these things to take hold. And so we're starting to see everything that they said the ACA was going to do. We're starting to see that. But this man was talking about the hospital closes and the counties, because he was saying predominantly these rural counties, it's seniors, it's the disabled, it's veterans, and it's kids. And he was literally, he got tears. He was literally crying at the idea of these hospital closes. This grown
Right.
man at a forum, you know, could not hold back his tears for what was happening. And this is how people are feeling all across the state.
Well, I don't think there's any group, even insurance CEOs have come out against this law. And when the insurance CEOs who do not like to speak up about anything
Yeah.
are coming out and saying this is going to cause, people to be hurt, higher premiums, the AARP, the National Hospital Association.
Right.
There's no one.
And then that's another thing we know about rural areas. They're going to have higher rates.
Right.
Which is ridiculous. And then, of course, what the AARP is really coming out against is that age tax.
Yes.
If you're 53 to 64, they can charge you 5 times more than anyone else.
Right.
And that's outrageous. It's just, to think that, because I happen to be 53, you can be the healthiest person in the world, but you're still going to get charged 5 times more because they can.
Right.
And to me, that's just, it's unacceptable.
I think so too.
And then, of course, a lot of people think, senior citizens thinks, well, I've got Medicare, it's not going to affect me. But if you are on Medicare and you have high prescription costs, you're going to go back to having to pay 100% on your
Right.
medications when you're in the donut hole. And that can be a lot of money. If you've got diabetes, if you've got COPD, if you've got arthritis, those medications, many of those medications are name brand, and you will have to pay 100% of them. And the ACA, what it did was cut down by percentages each year how much you had to pay in that donut hole. And with the ACA, by 2020,
Right.
that was supposed to go away. You wouldn't ever have to pay that full amount. There would be no donut hole.
Right.
And, we owe that to our seniors, I
Yeah.
think. I mean, there's so many reasons that this bill should not be passed, and there are things wrong with the ACA. It's not a perfect piece of legislation. But anytime you have any huge legislation that encompasses 6% of our budget, there's tweaks. I think with Social Security, there were 12 years that they had to tweak it
Right.
to get it right. And so certainly we need to be tweaking it. There are experts out there that have suggested all the things that we can do to make it work better for more people. But the biggest problem in Tennessee that people don't understand is it's because our problems are because we didn't expand Medicaid.
Yes.
If you go to a state that worked with the federal government and expanded Medicaid, they might have 15 providers, and we are struggling for providers because of the sabotage and because of our Tennessee laws, not because of the ACA.
Yeah.
But our legislators would certainly like for the general public to think it's because of the ACA.
Yeah, they want us to think that, to borrow Senator Alexander's analogy, that the bus, something's wrong with the bus, when they're the ones who have been ripping parts out of the bus
Exactly.
for the last, 7 years?
Right. And I know we were both at an event. Our senators don't seem to want to have public forums with us, but what they will do is show up at fundraisers for their party. So we sort of ran down Senator Corker at a fundraiser in Blount County for the Blount County Republican Party, and he was nice enough to come out
Yes.
and talk with us, and you got to have a good conversation. The thing that I thought was really interesting about that conversation was you seemed to know a little bit more about the lawsuit than he did. So can you tell us a little bit about that?
Yeah. So part of the Republicans have sabotaged the law in a number of ways, but currently there's a lawsuit winding its way through the courts about the cost-sharing benefits, which is not your premium help, but certain people who fall within the income guidelines, as I understand it. The insurance company is also supposed to reduce their out-of-pocket costs, so deductibles would be lower for them, office visit copays, prescription cost copays. And right now, the insurance companies are still doing that as the law winds its way through the courts, but the federal government is not reimbursing them for those costs. And so something they could do right now that would help people and help stop the rising costs of premiums would be to just give up the lawsuit. Let it go.
Yeah, pay the money that you said you would pay.
Yeah, start paying your bills.
Right.
I mean, if I don't pay my bills, I get in trouble.
How come we have to pay our bills and they don't?
When I say, I'll pay you for that, I pay pay it. And, you know, part of the reason that some of the marketplaces are in trouble is because the Republican Congress throughout the years has been nitpicking through the budget reconciliation process, taking away funding for this little portion here. They ended risk corridors in 2014, I believe, was the Rubio amendment, which that was responsible for many of the rural co-ops going under. The risk corridor was supposed to make up the difference for X amount of years if a company or co-op, insurance co-op, could show that they lost money because of too many sick people in their pool. And the risk corridor was supposed to help kind of ease some of that guesswork so that they could figure out where the premiums needed to be for this new pool of people that had joined. But so when they took that funding away, a lot of insurers were like, well, we're just going to get out of this marketplace altogether. And also many of the co-ops that were one of the only options in some very rural places folded because without that reimbursement that was supposed to be a part of the law, they couldn't keep it up.
And this is what I find with so many people who are against the ACA. They keep citing these problems. They don't know, and they haven't done they're not a mom who relies on ACA, so they haven't done the research. They don't know all the wonky stuff about how the GOP has sabotaged this legislation to ensure that it doesn't work so they can make this
now
ploy.
they can say,
And I think another thing that we haven't mentioned, which I think is definitely bears mentioning, is that these more than $800 billion cuts to Medicaid they didn't have to be any part of the ACA.
No.
This is outside of that. This is clearly cutting this money to Medicaid is in order to create a tax break for millionaires, billionaires, pharmaceutical companies, and insurance companies. And so they are taking more than $800 billion from Medicaid in order to give a tax break to the wealthiest Americans. And we know that 400 American families will get a $7 million tax credit because of this legislation as it is. And so we're taking money from Medicaid, which is the disabled, veterans,
children,
funds people in nursing homes, and children to a large degree, and moms, you know, maternity care. So what in the world are we doing? You know, how in the world is this a good idea? This is not who we are.
Right.
In my opinion, I mean, when I saw that thing that 50% of the kids will be at risk of losing insurance or losing health care in this country, I just thought, well, he's right. It is a mean bill.
Yeah.
And when they passed it, when the House passed it, they were smiling and grinning and high-fiving and you know, clinking their beers. I'm just thinking, who are you? Because that's not the American people.
No, I mean,
you know, you left coal miners in the dust. You're leaving kids in the dust.
Yeah.
You know.
Yeah, we have a responsibility to children.
I think we do to everyone.
To everyone, but to children especially. Like, who says, no, those kids don't deserve it?
I could knock on any door. I think I could knock on any door and say, do you believe that children should be able to go to the doctor when they're sick?
Yes.
And I think every single time I'd get a yes.
Yes.
You know, and what we're talking about is, do you believe that an American should lose their home or their business because they get sick?
Right.
Absolutely not.
No.
You know?
But that's where we're headed, back to the bad old days.
Yeah, and I don't think a lot of people remembered, and sometimes I see people on TV and I meet legislators, and I know a lot of legislators. They can't tell me one person they know who's uninsured. Used to, you know, 5 years ago, I could name 100.
Yeah.
You know, today, I can't name that many. I can still name some because of the people who were in the gap.
Right.
But my friends who were hairdressers and musicians and artists and self-employed, you know, this has done so much for self-employed people, or it's allowed people to start their own business because now I can have insurance.
They feel that.
I remember at a time I was teaching, I was also doing tutoring on the side because you're a teacher, you need to make extra money.
Right.
So I was doing tutoring on the side, and I was doing so much tutoring, I was thinking, gosh, you know, I could just tutor, start my own business. But then I went, I've got to have health care because
Right.
I have a pre-existing condition.
Yes. Mm-hmm.
And so I knew I could not get health care at that time because there was no ACA. But it just freed up people. You know, and I talked to so many moms who have businesses in their homes, and, you know, they're able to stay home, you know, do childcare with their kids and also run their business. This has been great
Because
for our
they
country.
knew they could get affordable care.
Right, and they didn't have to
Yes.
worry about that pre-existing condition, which it can be anything. And that's another thing when you talk about one of the horrible things for me is going back for women to
Right.
being a woman is
That's
a
just-
pre-existing
yeah.
condition.
Yeah.
You know, and it's still going to be, because if they take away those 10 essential health benefits, that's maternity care, that's, you know, prenatal care, all of that stuff. And I just think that that is absolutely unacceptable. You know,
Yeah.
it's funny, I heard actual men in Congress say that, well, I shouldn't have to pay because I'm not going to need, you know, maternity care. Well, whatever he has, I'm not going to need either.
Yeah.
It's not your world and we live in it.
The
You know,
whole-
we're a community.
Right. Well, my house didn't burn down, so I'm not going to pay my home insurance premiums. That helps pay for some, you know, somebody who
Right.
did lose their house.
Yeah.
Like, that's not how it works. It works, you put money into the pool when you're healthy
Yeah.
so that it's there when you do need it.
When you live on your island alone, you
Yeah.
can do that. But we all rely on each other. We rely on a community. We want our community to be great. We want
Right.
Knoxville to be a great place to live. We want Tennessee. It is a great place to live. But, you know, if we want to be the strongest country in the world, we need to be the healthiest country in the
Yes.
world. And I think that we hear that a lot. But probably should stop and talk a little bit about action. You said you visited the office. It's very easy to do.
It's
right?
very easy to visit the office. I usually will write a letter, a short letter, and leave it with them. And then if you're nervous about talking, you can even just read the letter to them if you want. But visiting the office is probably one of the most effective things you can do. I call daily, email, faxes, even written letters. But I find the office visits to be the most effective as far as like response back from the staff. But
Yeah, and if you want to know, there's some events happening tomorrow. Well, Friday at noon. I guess it will already have happened. But the Knox County Democratic Party and the Blunt Young Dems are going to have a press conference in front of Alexander's office to kind of get this information out there and talk about it. But also on Wednesday, the 21st, there's going to be a die-in. We're meeting at Market Square at 6 o'clock, and people are going to make headstones that
Right.
have like their pre-existing condition or something like that, and we're going to stage a die-in to show what's at stake. I mean, people stand to lose their lives, and so we need you to call your senators. We need you to write your senators. Another great thing to do is write a letter to the editor about how you feel about this health care. Because you can write a letter and shoot it off on email and they can get it in relatively quickly. But they're talking about voting before July 4th. And so we need to do everything we can to make sure they wait on that and to make sure that they have public hearings first so we can talk about this, because they haven't involved experts and they haven't involved the American people. And I just think moms like April with her 2 kids, she's very busy, but she's out there fighting for this because it's important to her family. And there's so many families in Knoxville that will be affected by this. So please write your letters and make those calls and do everything you can to make sure that we stop this legislation from being rammed through. But thank you guys so much for being here, and we will see you next time on DTV.